Sudden infant death syndrome, sudden unexpected deaths in infancy, they are a usual occurrence in all of the countries worldwide. It is a major problem that we are dealing with. So, whenever you are investigating such a case of sudden infant death syndrome, infancy deaths that are unexplained even after a complete necropsy has been done, even after a complete or detailed investigations of the crime scene has been done, but you are still clueless and you don't find any evidence regarding the causative factor for the death of the infant, then it is termed as the sudden infant death syndrome. Whenever you are dealing such a case of SIDS or SUD, what are the laboratory findings and what are the external findings that can be found whenever we are carrying out autopsy in such a case? So, working as a forensic practitioner, working as a forensic pathologist, it is the highlight over here that you should know what are the characteristic findings for SID, what are the histological samples that we should send to the chemical pathologist, and what findings he is going to look for whenever he is going to basically commence that this death was termed as SIDS or it is termed as SUDS, and that he'll be writing that in the cause of death. So in this third section, we'll be discussing the case history. How are we going to collect a detailed case history, especially from the parental, from the maternal as well as the paternal side? We are going to have a complete detailed history, and that is going to be quite revealing over here in this investigation, because sometimes there are relevant sibling deaths as well as deaths of the other relatives. Death scene investigation is again very important over here. Histological findings are quite common over here. Then we have the causation theories that are again very importantly discussed over here. Histological findings, after we have sent the samples to the chemical pathologist of the lungs, the brain and the kidneys, he is going to have the specific findings, the specific markers for the SIDS over there. So he is going to highlight them. Of course, he is not going to comment upon them, it's not his duty, but he is going to send back the report, and then you're going to write down the autopsy according to the report of the chemical pathologist. Now, the case history in such an individuals is very important. The brief and remarkable case history should be taken. It should be a detailed case history. Even the maternal side and the paternal side has to be investigated for any near relative deaths of such a condition. It's again going to be very revealing in such cases. The deaths are usually rapid and silent deaths. That is why it is unexplainable what was the cause of the death, because it is usually quite a silent death, and usually the parents give you a history that the baby had the early morning feed and he or she was fine, and then they found him or her dead in the cot. So that is going to be quite debilitating for both of the parents, but you still have to get a complete and detailed history. Death within minutes occur. So this crime scene is investigated in detail, and you're going to have the external findings as follows. The external conditions: the size of the room is taken, the size of the windows, the heating environment, all of this has to be documented in detail. So these points are again very important. All of the points that have been tabulated over here. The air exchange rate is again very important over here. Then the room temperature, that should be noted, and the temperature outside. Why are these temperatures so oftenly taken over here? Because we already told that one of the causative factors for deaths in such cases is hyperthermia. So surroundings are again very important. The type of bed used in the nurseries, the type of blanket, the size and weight of the blanket is again taken in detail over here. The type of mattress that was used in the nursery is again very important. The toys in bed, they are again very important over here. Then the situation found dead, that the position of the body, the clothing, the covering is again very important. Whether sweating was there, if vomitus is present, it has to be sent to the chemical pathologist, and the fixation which was used is again has to be documented in detail. Now, while we are doing the external examination, we have to look for the signs of death. The time of death has to be calculated in detail. Then if the resuscitation is performed, any signs of that resuscitation, if they are there, they have to be documented documented over here. And then the signs of violence, they're also documented. The body temperature is again very important. Here I would like to emphasize the battered baby syndrome. It's quite common, and so the signs of abuse or the signs of violence, if they are found, they have to be documented in detail, because it basically is pointing towards the foul play. The edema fluid, which is exuding from the mouth, it's again very important and has to be taken to the chemical pathologist. If it is blood tinged and frank bleeding is there, one has to emphasize on the fact that what kind of a bleeding it is. And then the congested mouth or the pharyngeal vessels, they can be found in such a case. The stomach contents, they are sometimes present around the mouth, around the nostrils, or they are even present on the face. The hands are usually clenched, and that is basically defining that the baby was in a spasmodic condition, or a convulsion has occurred before the death of the baby. So that is again going to be very important. If it is the case, you have to document that the hands of the infant were clenched. Histological findings in SIDS are again very important. The focus lung changes, for example, the pulmonary inflammation is seen in a lot of cases. Peribronchiolar cell infiltration is seen. Other inconsistent findings, they include the chronic hypoxia, thickened pulmonary arterial walls. Gliosis in the brainstem is one of the risk factor over here. And then we have the retention of the brown fat in the adrenals. Abnormalities in the carotid bodies are seen in a lot of cases as well. As you can see in this diagram, the pointer is basically pointing towards a bolus of food in the trachea. So this whitish structure is basically over here, is basically in this diagram, is basically pointing towards the bolus of food. These are basically the findings that are quite common over here. Changes in the myocardium, adrenals, parathyroid, and liver is again very important, and they are quite consistent over here. The theories of causation are the allergy to cow's milk protein. House mite allergies are again very important, and the deliberate suffocation. So look for signs of deliberate external suffocation. Spinal hemorrhages are quite important. Botulism is again one of the leading causes over here, and the signs of tetanus or the tetanic convulsions are looked for whenever we are suspecting botulism. Calcium deficiency is one of the factors, selenium deficiency, biotin deficiency, vitamin deficiency, hypoglycemia and hypothyroidism, magnesium deficiency, carbon monoxide and carbon dioxide poisoning. Overlaying is basically defined as when the mother overlays the infant. So that is one of the theories of causation of the SIDS syndrome. Pharyngeal hypotonia is also the last but not the least causes over here. Moreover, the nasal obstruction, it can be one of the causes. Whenever we are talking about the external suffocation, one of the leading causes is the nasal obstruction as well. Then the tracheobronchitis. So it's basically an inflammatory condition, and that can also be one of the theories whenever we are talking about the causative factors. Respiratory syncytial viruses, prolonged sleep apneas, and that is why the apnea alarms were introduced, but they are of no value, and basically they didn't prove quite of an importance. Deficient or abnormal pulmonary surfactants were used. Cardiac conduction defects, it's one of the causes. Sodium overload in the feeds, narrow foramen magnums, hypothermia and hypothermias. Influenza infections, metabolic enzyme defects, immunodeficiencies, hypogammaglobulinemias. These are basically the deficiency of the gamma globulins. So that is basically defined as this gamma globulinemia. It's basically the deficiency of the globulins in the blood. So it's basically one of the conditions. And then we have the deleterious genetic mutations. It can be one of the causes for such conditions in the SIDS or in the SUD. So in this section, basically, we dealt with all of the laboratory findings as well as the external findings in detail whenever we are carrying out such an investigation. That is the end to this section. Thank you for watching sqadia.com.